Hi class, it's Dr. Balderas. We're going to talk a little bit about diathermy, and this is in chapter 10 now of your Cameron book. This will not be on exam one. We will go over this and demo it in lab, but it will not be a skill check. It'll just be for informational purposes for you to prepare you for your boards because there may be a question on it. You may, in a skilled nursing facility, utilize a diathermy, but so far the clinics that we've used, nobody has used this modality. But just so you'll be prepared for it, I probably will put a couple questions on the final exam, but we'll talk about that later on. Okay, so let's go. So this is just quick preview for you, so don't spend a lot of time, just kind of skim the chapter for now and just kind of get an idea of the spectrum and everything that's involved with that. So here's that spectrum. We'll be going over this when we start to talk about light therapy as well. So this is a good first look for you to kind of see where everything is at on here. So it kind of starts over here at the gamma rays on one end and AM on the other end. We see that visible light in the middle. And then on either side of that visible light, you have like the infrared rays, and then on the other side, the ultraviolet rays. And then way over here on this side between FM, TV, and AM is our shortwave on the diathermy on the spectrum here. Okay. So here's also kind of just breaking it down for you to kind of show you where things are. So here's where our shortwave are on that spectrum. Ultraviolet, we will kind of briefly go over that later on. Again, it's something that's not utilized too much anymore, but we will talk about more laser and light therapy as we go forward. Okay. So the application of shortwave or microwave electromagnetic energy to produce heat and other physiological changes within the tissues. So we're going to just talk more today about the shortwave radiation, not so much the microwave. So this just kind of tells you the radio frequency range, which we just saw on the spectrum over here and back over on this end here. So you kind of can see where that is. All right, let's go forward. The physical properties that determine if diathermy will increase the tissue temperature is the amount of energy absorbed by that tissue. So again, you can look back on that page that we referred to when we were talking about heat and the different tissues and how they can absorb things and their specific heat as well. So you can kind of look at that to know whether, fat versus muscle, what heats up faster. And then we talked about the electromagnetic field and the type of tissue that's involved. Okay. The advantages of shortwave, there are people out there who are big advocates of this because it does heat the tissues deeper in a larger area, whereas ultrasound goes deeper, but it's really for smaller areas, or it would take you a long time. And there's many other things we can do physical therapy-wise versus spending 30 minutes applying a modality for deep heat, like exercising, warming them up on the bike, that kind of stuff that will heat that tissue up deeper. It's studies to show are much more effective. But for some people, that deep heat in a large area is good. You don't get the periosteal burning, which we haven't done ultrasound yet, so we'll kind of pass over that until that point of time. It doesn't take long to set it up, and you're not necessarily have to be there with the patient as long as the parameters and you feel they're safe and they can ring the bell. If it's too hot for them, you can leave them unattended and go treat another patient. So financially wise, that works out well for some clinics. So this just talks about the different types of applicators that are out there, and this is important down the way for you. This might be one of those questions that they would maybe ask on a board question, which type of applicator goes into deeper structures versus more superficial. So the inductive coil is the one that will produce that deeper heat, and you can see the little eddy currents going around that area. Okay, so that would be an inductive coil. Also, the drum applicator goes deep, and so you can kind of see what that does. It has those same little eddy currents going on. Then the capacitive plates, those are the ones you would use for more superficial tissues where you're just wanting to heat up the skin. There's the same thermal effects you get with heat. You get the vasodilation, the increased rate of nerve conduction, elevation of pain threshold, alteration of muscle strength, the acceleration of the enzymatic activity, and that increased soft tissue extensibility. The tissues, as we talked about, get heats them deeper, and you have increased circulation of the muscles. Okay. This is just like ultrasound in the fact that you can have thermal effects and non-thermal effects based on how you set the parameters. This will make more sense once we go over ultrasound with you, but just so you know that both of these types of deep heat can give you a thermal effect, but then you can put it on a mechanical kind of setting where you're going to get a more non-thermal effect. So that's a pulse mode. You do this for a lot longer period of time, and this is more for like those diabetic ulcers, and this is usually how it is used in the skilled nursing facilities for those people who have pressure sores and decubiti ulcers. So it kind of helps with the oxygenation, and you get that phagocytosis going on to kind of help promote some healing along with the ATP and protein synthesis. So this is just a nice diagram showing you and comparing the difference between the different types of thermotherapy here. And so you can see that with inductive coil how it goes deep into the muscle. Capacitive ones is much more that fat, that skin, and does not really go very deep into the muscle at all. Microwave kind of is a little bit of both. And then ultrasound, we can see that it doesn't really go very deep in that superficial skin, and it gets into the muscle, and then it kind of goes back down again. Okay. Clinical indications, I'm not going to read over these. You guys can see they do pretty much the same types of things that we talked about with heat, just at a deeper level with the thermal effects. Contraindications, those implanted or transcutaneous neurostimulators, including pacemakers, because that electromagnetic spectrum is going to haywire all those, so not a good thing. Pregnancy, we know that's not a good thing for it. Metal implants, malignancies, eyes, testes, groin, epiphysis, anything where the heat is going to heat up and cause burning and more blood flow than you want in an area. But the non-thermal, the contraindications, again, are going to be those deep tissues such as your internal organs. Again, the electronic devices, the pacemakers, because still it's an electromagnetic field and it's going to cause haywire and maybe make it misfire. Okay. Precautions near electronic or magnetic equipment, obesity, and just think about obesity. If you look at that chart in Cameron about the different tissues, fat is one of those higher conducing ones, and so it can burn quite a bit faster, so you got to be really careful with that. IUDs that were copper bearing, also same kind of thing. Non-thermal would be that pregnancy, the skeletal immaturity. Burning obviously is the biggest adverse effect. You want to at least have a dry towel in between the patient's skin and the applicator so that it absorbs the sweat, because that sweat also will heat up and could cause a burn. So in those pictures that we saw earlier, they really needed to have some kind of either their own clothing or a dry towel to keep them from having that happen. When you're applying this, you want to remove all metal jewelry and clothing. You want to clean and dry skin. You want to inspect that skin. We talked about that. You want to check the sensation. You want to make sure there's no open wounds. You're going to position that patient comfortably. Thermal application, you're going to wrap the area with that toweling like we talked about to absorb that perspiration. And then you can position the device and apply it and set the parameters for it. Okay, so for thermal, it's usually a mild warmth for about 20 minutes. Non-thermal, it's much longer. We talked about that. And this is where, when we talked about you don't want any open wounds, well, this is where you would actually use it over an open wound. You just have a covering over it to make sure that you're not touching it directly. You want to make sure they have a call bell and that you're checking that skin after 5 minutes, especially that first time you do it with the patient. If you're going to use this in the skilled nursing facility and you're not going to be attending them, you want to make sure they have appropriate mentation as well. So documentation is just talking about being able to say, what did you see when you checked that skin? Was it intact? Was it red? What was the measurement of the wound? I know Christine Gallion taught you guys how to measure a wound and describe it, so you would want to do that beforehand if you were using this for wound healing. You want to see how it looked afterwards, the area of the body you're treating, what the parameters were that you set. how long was it for, what position did you have that patient in, the distance, and their response to the treatment. Okay, so that's it for that one in a nutshell. We'll see you on Monday. Thanks. Bye.